Hello, ladies and gentlemen. Thank you for allowing me to present this investment opportunity to you today. My name is Caroline Wilson, and I am a health education specialist. Today, I will be talking to you about a new cardiovascular disease initiative called Healthy Heart. Throughout the duration of my presentation, the need for a cardiovascular disease prevention program will become clear, and I will outline the campaign goals and objectives, implementation strategies, anticipated barriers and their solutions, and future uses for the information gathered throughout the evaluation process. So without further ado, let us begin. Why heart disease? Well, despite national prevention efforts, cardiovascular disease remains the leading cause of death in the United States. This is even more startling when we consider that cardiovascular disease is largely preventable. What we mean by this is that the vast majority of risk factors, to include stress, high blood pressure, high cholesterol, diet and exercise, and smoking, are all related to lifestyle choices. As a health educator, this means that we have the power to change people's lives. This point is further proven by the fact that studies have shown that people of low socioeconomic status have the highest cardiovascular disease rate, the cause of which has been conclusively linked to insufficient health knowledge and low health literacy. Above all, this means that through proper education, we can save lives. Now let us evaluate the target population. The target population for the Healthy Heart program is women in Lansing between the ages of 30 and 50 years old. Lansing, Michigan experiences a high prevalence of heart disease. In fact, the city is the second highest rate reported in the state. So obviously developing a prevention program within the city limits would be effective. Next, women are uniquely at risk for developing heart disease. 1 in 4 women in the United States will die from some form of cardiovascular disease. And even more startling is the fact that over half the women, which is 64%, who die suddenly of heart disease experience no previous symptoms. There are actually many different kinds of cardiovascular diseases that women experience at a disproportionately higher rate than men. Diseases such as coronary microvascular disease and broken heart syndrome are suspected to be caused by a depreciation of estrogen levels during menopause. So this means that the risk increases with age. So we are focusing our efforts on women between the ages of 30 and 50, and not 50 and over, which is when menopause occurs. So you might be wondering how we got to this age group. The answer is quite simple. Prevention must begin early. So cardiovascular diseases do not have an acute onset. They are the result of years of poor health, lack of physical activity, unhealthy diet, hypertension, and hyperlipidemia. So the best way to reduce the prevalence of heart disease within this population is to teach women the importance of pursuing a healthy lifestyle and blood pressure, cholesterol monitoring before they enter menopause. So there are many considerations for this age group that qualify the need for assistance. We're going to take a quick look here at the demographic information for Lansing, Michigan. An astonishing 12.5% of citizens do not have health insurance. In addition, almost 30% of the population is living in poverty. Given that over half of the population in Lansing, Michigan are women, it's fair to assume that there are members of our target population that meet the above demographics. So to us, the biggest concern here is reaching individuals living in poverty and without health insurance. Women who do not feel they have the means to seek and obtain prevention services are unlikely to do so unless we provide them these means. So developing interventions that specifically overcome this disparity will be key to the program's success. All right, so next I will outline the program goals and objectives in order to communicate to you what our program will accomplish. So the first short-term goal of the program will be to educate women in the target age group about the importance of heart health, risk factors that jeopardize that health, and the things they can do to reduce the risk of getting a cardiovascular disease. There is one short-term objective for the Heart Health Program, and that is to increase the use of prevention services, primarily blood pressure and cholesterol screening. So achieving this goal will require a collaborative effort on behalf of the Michigan Department of Health and Human Services and local health facilities such as Barrow Hospital and Ingham Regional Medical Center. Finally, this program has one long-term goal, which is to reduce the prevalence of cardiovascular disease in women ages 50 and over in the mid-Michigan area, thereby reducing the cardiovascular disease rates both state and nationwide. So to ensure that our campaign meets these goals, we had to develop a campaign design, and that is what I'll be going over next. So we began with cause-effect statements. We used the model Cause-Effect Theory Structuring Guide to help us develop a causal relationship between the proposed program activities and the desired effect. So we had to develop a cause-effect statement for each of the program goals and objectives, and I will present them to you now. So the first program goal, cause-effect statement, is public education on the importance of cardiovascular health, risk factors of heart disease, and methods of reducing risk will cause a change in the perception of importance of heart health and lead to positive lifestyle changes by 6 months' time, and will require effective health communication and appropriate health literacy. The cause-effect statement for the first program objective reads, the increased use of hypertension and hyperlipidemia screening as a method of prevention will change the individual's awareness of their own health and empower them to make positive lifestyle changes by 6 months' time and will require collaboration with both the MD-HHS and medical facilities in the local area. And finally, the program's long-term goal of reducing the prevalence of cardiovascular disease is addressed as follows. By providing long-term education and free health prevention services to an at-risk population, the state will see a reduction in cardiovascular disease in women ages 50 and over the next 20 to 30 years, and will require long-term education, evaluation, and monitoring of women's health. So through these statements, it's clear the program activities are designed to meet the program goals. So the rest of the campaign design was developed in accordance with the health belief model. The health belief model has 3 sequential components. First, the population's perception of the health threat, in this case cardiovascular disease, must be assessed to include the perceived severity of that threat and their own personal susceptibility. Second, the demographic, socio-psychological, and structural variables must be evaluated, and appropriate interventions are developed accordingly. Finally, benefits of avoiding the threat must be effectively communicated to the target population and must be more significant than the barriers preventing change. So the HBM model is ideal for this kind of program because of its known effectiveness in prevention health, which is in line, of course, with the program's long-term goal of reducing cardiovascular disease in the target population. In addition, by following this model, we can ensure that we are providing effective health literacy and that communication and interventions are culturally appropriate. So the information obtained by following the HBM model during the planning stage will speak directly to health literacy, which will influence the development of health communication materials. So delivering health information is perhaps the most important part of the health campaign. It is for this reason that determining the modes and methods of delivery is crucial to program success. So due to the projected length of the health program, the health information that we will be providing our population must be delivered over a long period of time and through a variety of different methods. So to begin, all methods will be used within the local Lansing area, given that the resources available to the women will also be in the Lansing area. We're going to concentrate our efforts directly in the city limits. Next, because women in the target demographic are of working age and are likely to be mothers, we plan to approach major employers in Lansing and seek the opportunity to give brief presentations regarding heart health to their female employees. Additionally, we will reach out to local PTA groups for similar opportunities. It is in this way we will be providing targeted presentations directly to our demographic. Next, posters and brochures will be developed and displayed in women's health clinics throughout Sparrow Hospital and Ingham Regional Medical Center and in public health offices. I'm sure we are all aware of the Women's Expo. It takes place every year, and over 275 vendors and exhibits are usually present. This is of course an ideal location for the heart health program to set up a booth and provide public education directly to our demographic. We plan to, with the help of a certified health provider, provide free blood pressure checks to women at the Women's Expo. The next method of delivery is through billboards and radio advertisements that will briefly capture the importance of regularly testing blood pressure and cholesterol for women in the target group and encourage them to visit our website for more information. And that finally brings me to the final method of delivery, which is an online campaign, which will obviously offer more information and more resources to the target population. So we chose these methods of delivery for a couple different reasons. First, they are all sustainable. As previously mentioned, this program will last for a very long time. So these different interventions we can change, we can modify, we can keep them up to date. So they are very sustainable. Second, by incorporating a variety of methods of delivery, from the pamphlets and brochures to the Women's Expo and the radio ads, we're reaching the target population in multiple different ways. So if a woman does not receive the health information from one source, she is very likely to receive it from another. It is in this way we are really reaching the maximum number of the women in our target population. And finally, we can change any one of these methods should our evaluation reveal that they are not effective. So because health education is paramount to achieving the program goals, following through with these methods of delivery will absolutely mean program success. Okay, so we will be going over the different components of implementation next, beginning with resources needed for implementation. One of the biggest resources that we will need is partnerships and stakeholders. So we've identified the Michigan Department of Health and Human Services, various local health facilities to include the two major hospitals within our city, Sparrow Hospital and Ingham Regional Medical. We're also going to approach private practices as well, and of course the public health office. Other potential sources of partnership and stakeholders include Michigan State University and Lansing Community College. So should a collaboration be made with any of these individuals, we will be able to obtain resources that they offer and incorporate them within our program. So generating funding is only one part of the implementation of the health program.